My insig is amper baie ver geaffekteer deur die cataract, want die cataract is besig om my regteroog ook skade aan te doen. En daarom het ek vandag gekom om die cataract af te haal. Is nou meer as 3 jaar wat die cataract in my oog sit.
So I think the need in the rural setting is defined by a lack of resources, vast distances, staffing issues. And I think reaching our patients is always difficult. Giving them the care that they need is often quite a real problem. Yeah, so if we focus on the cataract surgery, we've got an incredibly long waiting list. We've got a lot of patients in the district who need the surgery. Because we cannot always get our patients the care they need, they wait for years. We've had patients that are receiving care this week that have been on the list for 3 or 4 years who haven't previously been able to be offered the surgery, and now we are able to clear these lists, and it's truly wonderful to be able to do that. If you talk to the patients how grateful they are, that is really phenomenal.
Stellenbosch University is one of the universities in the country, the faculties of medicine and health sciences, that have the largest distributed training platform. So we train in both urban and rural areas. So we recently, in July or June of this year, we visited the central Karoo. And while we were driving on one of these long roads between the various facilities, we started to conceptualize an idea of seeing how we could help the central Karoo to achieve some of its goals of access to health care. That sparked an idea between myself and Karin and Albi van Rooy and Z Brickles, who's the director for the area, that maybe we can do something with the resources that we at Stellenbosch University have at our disposal. We also have good links with places like the dental school at UWC, and so using my network, and Karin's network, of course, we were able to think around how we could have something that supports their needs. We first engaged with Professor Linda Visser, who's the head of ophthalmology at our faculty, and she linked us up with Africa 2020, which is an NGO from KZN, who has a mobile cataract surgery theatre that they take around the country, and so they're coming down to join the InReach.
Main aim is to take, with utilizing what we have, is to go into the communities and into the district hospitals and try and alleviate what our waiting lists that we've started to find are starting to build around the country with regards to cataract surgeries. And a mobile, what we call the MOR, or mobile operating theatre, mobile operating room, which we are able to set up in any sort of community hall, in an OPD, which we have done this week at Beaufort West Hospital, where we have a completely sterile theatre which is able to perform cataract surgery with surgeons that have volunteered their time to come in and help to reduce the numbers that are on these waiting lists.
So this has a very unique opportunity in the fact that we are trying to alleviate the waiting list within the region and to facilitate or to facilitate and restore vision in these patients who have been waiting a long time, but also for our registrars to be exposed to non-tertiary or non-complicated eye surgery. Second to that, within the InReach, we have also partnered with the University of Western Cape and their dentistry faculty. So they are bringing their mobile units and they anticipate to provide dental care to approximately 300 children and adults over the course of the weekend. So we really are very excited about that. Their heads of departments are also bringing along a set of students that will then also be able to serve as they learn and as they grow in their skill set.
Whenever we have outreaches, which is what we call it, students are always excited to join us because it's a great learning platform, and we always tell them that when you go for community service, this is the kind of setup that some of you might have, so it's good for their confidence. They want to help and they want to learn.
There's been a big focus on primary oral health care, which is part of those extractions, removing pain, removing infection, and removing teeth that are mobile and not allowing the patients to function properly, in other words, to even eat properly. So it's quite rewarding for us as dentists to be allowed to collaborate with the medical students and even with the Western Cape government. And it's very rewarding for the students as well to be able to take the clinical platform from the university and apply it in a rural setting, in an education center, in a very mobile way. So it's quite rewarding for them to be able to adapt that way and to relieve the demand that's on the local oral health clinic, but also in the local communities.
So we have a very wide, can I say, area of patients that needs to be covered, and that's why the waiting list is so long, because we only 2 dentists that needs to cover all these patients in the whole central Karoo. The InReach helped us a lot at this stage because we had a very long waiting list now, and so they could see all our extraction patients, because that was the biggest need now at the moment for our patients.
Collaboration is always going to be needed through resources, through expertise, and ultimately our patients are always going to benefit. And I can guarantee you, if you ask them now, would you guys like this to be a regular occurrence? The resounding answer is going to be yes.
In the rural sector, especially in the Central Karoo, we're very far from definitive care. So we are heavily reliant on external partners coming in. So interdepartmental collaboration like we've had here with Stellenbosch University, the team from George, everybody coming in and making a difference in all these patients' lives has been, it's been mind-blowing. I've been completely humbled by it. And we're so reliant on those services, on those specialist doctors and teams coming in that it can't be done without them.
In addition to the postgraduate ophthalmology registrars and the dentistry students, we also have a number of our own undergraduate MBCHB students who will be working alongside us. Some are currently rotating in the region, and others have volunteered to accompany us on the weekend. So this has a dual function. The first is, of course, that it is a very unique opportunity for students to see what rural health looks like, what the rural region looks like, because many students function very much within urban systems as they grow up. So that is that one component. And the second is that our students have also volunteered their time to assist during in the periphery of these operative techniques. And we have some of our emergency medicine specialists who will be doing teaching board rounds on the weekends, on the weekend with these students.
We will also do continuous professional development, which is what every health professional is required to do to maintain your skill set. So the colleagues in the Central Karoo asked if we could help with point of care ultrasound, and so our emergency medicine colleagues will help us with a workshop in the morning on the Saturday of the InReach, and in the afternoon we will do the clinician as teacher. These clinicians do a lot of work for us as a university, and we need to ensure that they are skilled to do supervision in the clinical setting.
And it's really been great. You have to see it to believe it, and I think that's sort of the catchphrase of the week. It's become a vision restoration InReach, who's been dependent on so many people and organizations, departments working together, reliance on the universities, and it's worked really well.
En ek wil graag my lisensie gemaak het as my oog reg gewees het. Maar ek vertrou die operasie gaan 'n sukses wees vandag en dit wat ek verlang om te doen, dat ek dit sal regkry met die hulp van die Here en die dokters.
En die dokters natuurlijk.